everybody, I am Dr. Suchitra Bhatt, working as medical retina consultant in Ashoka Hospital, Kannu and Netra Jyoti Thaliparamba. I mainly deal with diabetic eye related problems. Okay, so now how does diabetics affect my eye, or which part of the eye does it affect? Diabetes can affect any part of the eye just like diabetes can affect any part of our body. So, to begin with, normal eye is this way. This is the front part of the eye which is called as cornea or Krishnamani. This is the lens of the eye where the cataract gets affected, and this is the retina of the eye which is also called as the nerve of the eye. So, the diabetics mainly affects the retina of the eye. The retina of the eye is divided into three parts. This is the optic nerve connecting the eye to the brain, and this is the macula which is mainly responsible for the vision, and this rest entire part is the peripheral retina which has lot of blood vessels. And eye is the only part in the whole body where you can visualize the blood vessels directly. So, coming to the front part of the eye, when we are diabetic, we will start having the first symptoms. Most of the times people come to us is you will start having recurrent stye or polakuru, dryness, gritty sensation, itching. These are all related to diabetes. In the cornea, you might have more of erosions, that is like wound in the eye is more common in diabetes. And in the iris and the anterior segment of the eye, you might get lot of inflammation or swelling of the eye. So, the most importantly commonly affected part of eye in diabetes is the retina. Okay. Why does it affect the retina? Retina is full of blood vessels. So, when we are diabetics, our blood circulation starts getting altered or changed. Hemodynamics is totally changed. So, due to this change in hemodynamics, the retina of the eye is affected. So, how does retina gets affected in diabetes? It can get affected in many ways. The commonest ways are, you might have fluid in the eye which is called as macular edema, where we will have problems in reading. So, there is fluid in the center part of the eye, that is this part of the eye which is responsible for the vision. The other thing which can get affected is, due to the deficiency in the blood circulation, new blood vessels starts coming in the retina. These new blood vessels are like unwanted weeds in the garden. These new blood vessels do not have strength to sustain, so they rupture and cause bleeding in the eye. As you see in this photograph, this is due to diabetics. So, once the bleeding occurs in the eye, suddenly the vision drops. Other thing that happens in the retina is, there is lot of unwanted membranes when these bleeding blood, when these new vessels get jointed and they are there in the eye for the long time. So, how to diagnose or how to treat these diseases? These diseases which are affected due to diabetes in the retina is called as diabetic retinopathy. So, for the diabetic retinopathy to develop, the duration of the diabetes is very important. I repeat, the duration of the diabetes is very important. Even if your diabetes is under control, it is always under control and it has never increased. Still, if you are a diabetic for more than 5 years and if you are asymptomatic also, you should consult an ophthalmologist, because the symptoms develop in the last stage of the disease where the bleeding has already occurred and the treatment becomes difficult. It is a must to consult an ophthalmologist and do a dilated examination of the eye. Dilated examination means we put some drops and dilate your pupil so that we can see the entire retina. Unless you dilate, you can't see the retina fully. So, after that, once you do your first consultation after 5 years, then every year as the doctor advises, or every 3 to 6 months as your ophthalmologist sees your eyes, you should follow regularly. It is not that once you show the eyes to your ophthalmologist, it is not over. You should regular follow up is a must. So, to conclude, diabetic diseases related to the eye are very much treatable. Not all diseases related to diabetes lead to blindness. Don't compare your disease with your neighbors or your relatives. Diabetes related to the eye is different. It varies from person to person. The stage varies from person to person. The response to the treatment also varies from person to person. So, don't get scared seeing your neighbor, friend losing vision. They might be in the last stage, you might be in the first stage. So, first thing, once you are diabetic, control your diet, do regular exercise, and the most important thing, reduce your stress, which most of us neglect. So, combination of all these factors, and with your cooperation and our cooperation, this diabetic retinopathy can definitely be treated, controlled, and blindness can be prevented in young people.